you a Game of Thrones fan? Remember the phrase, winter is coming? Winter is coming. We've already had a rather unusual year, and we're not done. Economists seem to agree that we won't find a new normal until 2021, end of 2021, or even early 2022. So far, many employers have resisted taking control of their healthcare budgets long term, either because they have had a flat or negative renewal, or because they can avoid putting their people through any more change. I'm not sure how much longer that's going to continue. If you need to make changes for whatever reason, your budget shrinks, your plan isn't working for the members, or any other reason, let me give you a map for how to make the change and improve your employee retention at the same time. I think for most of you, that's still a big concern. My name is Allison DePauli, and I started Altiqe Consulting to help employers like you get control of their healthcare spend and get budgeting predictability. The happy side effect of that is better access to high quality care and lower out-of-pocket costs for your employees. If you like what you find here, subscribe to my YouTube channel down here somewhere and hit the notifications bell to be notified when I upload new videos. First, assess your current plan. Yes, you've heard me say this 100 times, you're going to hear me say it 1,000 more. Get your data. This is new. If you're fully insured, we have some resources to help you get your data. Reach out to me directly and I'll be glad to share how we can help you do that. You need to know your per employee per year cost. Benchmark it so that you can map where you want to drive that cost to. National average is about $15,000 per employee per year. Texas, where I am, is quite a bit lower. Typically 8 to 10,000 would be average. I have, however, seen one employer in San Antonio with a $16,000 per employee per year. So for Texas, I'd like to see a plan run at $5,000, maybe a bit less. So take your number of employees, multiply by 3,000, and maybe plan for that number. Have those claims that you just got information on analyzed. Focus on your top 10 to 20% of claimants. Yes, you can see the claims without having to know who the actual person is. You'll find that 10 to 20% of your population is driving 80 to 90% of your costs. When you see that, you will begin to identify ways that you can control those costs without penalizing your employees. Next, create a plan for the next 12 to 36 months if you have that much time. If you're in a financial emergency, there are ways to do that faster. I don't think most people look at their healthcare plans or their vendor partners in this way. What do you think about that? Do you think that if you look at your healthcare budget this way, through the supply chain lens, that you might get what you need more effectively? Better plan, less waste, lower costs, whatever it is that you need. Okay, next, roll it out. I don't think most of you will do face-to-face meetings this year, or maybe they will be a bit more toned down. There are plenty of tools to help you communicate benefits, and not just one time, but all year long. And those tools will help you fill in the gaps. If you've been here for a while, you know I like tools that an employee can add to that phone they have in their back pocket all the time. They're inexpensive. They provide 24-hour access to advocacy, a nurse, telehealth, almost anything you want. Once you've implemented, measure. That's why you need to know your per employee per year cost now so you can drive it where you want it to go. I don't think that nearly enough employers measure the performance of their plan. So once you've got it running, you can see what you need to tweak to be more effective. Okay? You know where I like to go best? When we have a plan performing so well and we have driven out as much waste, fraud, and abuse as possible that we can start offering 100% coverage. Imagine employees that have basically free healthcare. Do you think that will help you? And the most important piece of it all, shift how you think about benefits. Most people think about benefits as an operating expense. It is what it is. If you shift your thinking a little bit and consider that a capital expense that can be managed, controlled, and developed, then you can get where you want to go. So, if you like what you hear, if you're interested in leveling the playing field and making your healthcare plan work for you and your employees, if you're interested in saving your plan significant dollars, click the link below and let's see if we're a good fit.